Okay.
Good evening, everyone, and welcome to our virtual Family Council meeting. My name is Jamie Rose. I'm the Northeast Regional Specialist and also the virtual Family Council Coordinator. Words are hard today. So let's review our confidentiality reminder. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you're in, and we'll get you connected to your local ombudsman. And these calls have public access and are designed for family members and friends of long-term care facilities. All right, so we're going to review our meeting agenda. We're going to get our virtual meeting tips from Eliza, and then we're going to hear from Janis Meinert. She's from the Pennsylvania Health Law Project. That's going to end our Advocacy Toolbox series. And then I'm going to review our updated personal care home and assisted living guidance. It was just released yesterday. And then we'll review our upcoming meeting topics. So I'm going to pass it over to Eliza for our virtual meeting tips.
Thanks, Jamie. Hi, everyone. You all have been placed in mute upon entry to the meeting today. We want to try and keep the background noise to a minimum and ensure that we have a good quality recording available for those that are going to view it at a later date. If you'd like to speak or if you have a question, if you can use the raise hand feature. Once your hand is raised, then we'll acknowledge you and unmute your line. If you hover over your mouse near the bottom of the screen, you will see the participants pad. If you want to expand that, you can see who all is in the meeting with us tonight. The chat feature at the bottom of the screen as well, you can maximize it and it will let you chat with the chat moderator and others who are in the meeting with us as well. Closed captioning is available during the call. If you want the closed captioning, please hit the CC button at the bottom of your screen to enable the closed captioning. If you need to step away for any reason, if you can hit the stop sharing camera button, that'll turn the camera off on your computer while you're away. And then when you come back, you can just simply hit that button again and it'll bring your camera back on. Any concerns or complaints can be directed to the State Ombudsman Office. You can call us at 717-783-8975, or you can email us at ltcombudsman@pa.gov. And now it is my honor to introduce Janis. I'm going to read her bio. Janis, you are quite remarkable, I have to say.
Oh, thank you.
She has a master's level in social work with 35 years experience working as a social worker, therapist, and advocate for consumers, assessing physical and behavioral health services. For the last 20 years, Janis has worked as a paralegal and behavioral health specialist with the Pennsylvania Health Law Project. She's provided countless trainings to thousands of consumers and professionals on a variety of health-related topics. She's assisted more than 6,000 individuals with access to public health insurance programs and healthcare. She also developed 2 manuals at Pennsylvania Health Law Project: How to Obtain Mental Health and Drug and Alcohol Services in Pennsylvania, as well as The Many Doors of Consumer Empowerment, a guide to advocacy for mental health consumers. In conjunction with Community Health Choices, or CHC, Janis has also created a detailed guide on person-centered service planning, what Pennsylvanians with disabilities need to know about getting long-term services and supports in community health choices. That is quite amazing, Janis. Thank you for agreeing to come and share your knowledge with us tonight.
Well, thank you. I appreciate you asking. Now, Eliza, remind me again, because how much time I have. Go ahead.
We do end the meeting at 6.
Okay. All right. So some of this, I may get into in more detail than others. And then, folks will, you have my contact information right there, my direct phone number, my email. So people can certainly, feel free to to reach out. And I apologize that the Community Legal Services logo that's on that front slide was from a prior presentation. So I failed to delete them, but
That's okay.
they are not co-presenting with me, but they are certainly advocates in arms with the Health Law Project. Okay, thanks, Eliza. So
You're
I'm
very
just gonna,
welcome.
next slide, I'm just gonna just spend a very short time letting people know who we are, what we do, and how we can be a potential resource to you or to others. So I am with the Pennsylvania Health Law Project. We're a statewide nonprofit law firm, and our work focuses on helping people access public health insurance and coverage, insurance, and then services through public health insurance programs. So primarily when we say public health insurance, we're talking about Medicaid, what we call medical assistance, usually in Pennsylvania. We also help families of kids who get CHIP, the Children's Health Insurance Program. And we help people with Medicare, primarily people who have both Medicare and Medicaid. And we're going to talk a little bit about that later on in the presentation. So we help people with eligibility for these programs, and then we help them access services. The primary way people get to us is through our helpline that you see the number before you and our hours and days of operation. In the month of April, our helpline is only open Monday and Wednesday, 8 to 8. But generally, it's Monday, Wednesday, Friday. And then we also work with, other attorneys, other advocates, providing them with technical assistance on our areas of expertise. We do community education and trainings, unfortunately not in the community since last March with COVID, but do them both in person and virtually as we are tonight. We create a lot of materials, both for individuals accessing services and insurance themselves, as well as for other advocates. And our website is phlp.org. So folks can find lots of written materials, things that are 1 and 2 pages, or manuals that are 45 pages on a variety of Medicaid primarily related topics. We have a monthly email newsletter. And folks, if you're interested in getting that, please just email me and I'll be glad to get that to the right folks at the Health Law Project. And you'll be able to, get that sent to you monthly. They're also archived on our newsletter for people to look there. And then, so in addition to kind of the individual client work, the trainings and written materials that we create, materials on our website. Then we also do a lot of policy advocacy at the state level. And that policy advocacy is primarily generated from our individual client work. So, clients call us about an issue. We might see it once or twice. That might be enough to, raise suspicion that there's some problem in, some piece of the Medicaid system. And then we work really closely with the various state officials across the various Medicaid departments, Office of Long-Term Living, Office of Medical Assistance programs, Office of Mental Health and Substance Abuse Services, all those many offices that are, all fall under the Department of Human Services and the Medicaid program. Anybody can call our helpline. So you can be calling, on behalf of yourself or a family member or, social worker, other attorneys, anybody, is free to call our helpline. Our services to clients are free. We're a nonprofit and we do lots of grant writing and other kinds of things to help fund our work, but our services to our clients are free. Okay, next slide. Thank you. Okay. So just kind of a run through of what we're going to cover today. We're going to talk about specifically waiver and eligibility, even more specifically, I think, about access to Medicaid paying for nursing home care, and get through the clinical eligibility, the financial eligibility, talk a bit about, what kinds of services and who pays for what when somebody's in a nursing facility, and also talk a bit about nursing home transition services. Just some alphabet soup. I'll try to avoid these. Some may be, very familiar to folks. The CHC one I'll probably use more than anything else. And when I'm talking about the Medicaid managed care plans that are a part of the Office of Long-Term Living. And those are what the state has named the Community Health Choices plans. But you at least have them there for your reference. I'll try not to use those too much. Okay, so let's do an overview of the waiver eligibility. So there's two pieces to eligibility for people, whether we're talking about getting and the clinical eligibility and the financial eligibility pieces are the same, whether or not somebody is trying to access support, long-term services and supports at home in the community, or if they're trying to access them in a nursing facility. So, and we're going to talk through each of those, both the clinical piece and the financial piece. Okay. So in terms of the application process, that includes ultimately both the clinical eligibility and the financial eligibility. So somebody who is needing long-term services and supports and wants to see if they are Medicaid eligible to pay for those, the process starts with the state's independent enrollment broker. And right now that contracted entity with the state is Maximus, is the name of the entity. So the person, and you see the phone number on the bottom of the screen, as well as their the email. People contact Maximus, again, on their behalf, on behalf of somebody else, to say, I or a loved one is in need of, nursing home level of care or in-home support so that I don't need to go into a nursing home. And that's what, that's why I'm calling. So then the independent enrollment broker is responsible for shepherding then that applicant through the whole process. The first thing that the independent enrollment broker does then, if the person's not already on Medicaid, they will send them an application, a long-term care Medicaid application. Then they will, and of course, these are happening by phone still now because of COVID. Otherwise, it's an in-home visit by a Maximus representative, getting into more details about the program, about how this whole process works. And then Maximus is responsible for contracting the AAA, and actually the entity that kind of oversees all the AAAs. And then they will assign somebody to do, again, outside of COVID, it's always an in-home visit. Since COVID, these assessments have all been done by phone. And at this point are still being done by phone. So that's the clinical assessment. That is somebody who is trained to do the clinical assessment, the FED, the functional eligibility determination, and asks people, a very discrete set of questions about their needs that's primarily focused really on cognitive issues and the kinds of things people need help with in terms of activities of daily living, bathing, dressing, mobility, taking medications. Those are the primary focus of that assessment. And then from that clinical assessment, the clinical determination will be made whether or not somebody meets the criteria, which is a nursing home level of care. And we'll talk a bit more about how that's defined, whether they're trying to get the care in a nursing facility or at home. While that assessment is happening, the IEB is also, Maximus, is also sending a physician certification form to the individual, to the applicant's physician, whoever that applicant identifies as generally their primary care doctor. And that doctor also has to complete what's called a physician certification form. And if the doctor needs to, if in fact the doctor believes their patient meets the level of care that's needed in a nursing facility, that's the box that the doctor hopefully checks. And if the doctor says the person is nursing facility clinically eligible, NFCE, and the assessment determines that the person is nursing facility clinically eligible, then the process moves to the financial piece. If the assessment determines the person nursing facility ineligible, that they don't meet the clinical criteria for nursing home level of care, but the doctor's letter says yes they are, then it goes to the medical director at the Office of Long-Term Living for them to make that determination. Next slide, please. Okay. One more. So when we talk about nursing facility clinically eligible, what does it mean? Well, it is defined, and it's defined in regulations, most of which are federal regulations. Somebody is determined nursing facility clinically eligible when they have an illness, injury, disability, or medical condition diagnosed by a physician, and as a result of that illness, injury, et cetera, they require care and services above the level of room and board, and the physician certifies the individual, is nursing facility clinically eligible, and the care and the services they need are either skilled nursing or rehab level of care, as defined by regulations. They're actually Medicare related regulations, or the person has health-related care and services that might not be as complex as skilled nursing. Skilled nursing generally meeting nurses, some level of nurse, RN, LPN, to meet the person's need, or even rehabilitative in terms of other kinds of therapies, but which are needed and provided on a regular basis in the context of a planned program of healthcare and management, and were then previously available only through institutional type settings like a nursing facility. So, that's the legal standard that somebody has to meet in order to then become clinically eligible for nursing facility level of care or the in-home, what's often called waiver services level of care. And next slide. Okay. So, and as I said, if the assessment, that functional eligibility determination, yields a result that the client is not nursing facility clinically eligible and determines they are nursing facility ineligible, but that applicant's physician certification form says, I believe my patient meets the criteria and is nursing facility eligible, then the independent enrollment broker's job is to send the outcome of the assessment and the physician certification form, attested to, signed by the doctor, to the medical director at the Office of Long-Term Living. And then he or she gets that, the final to say, and not, outside of an appeal right. And when that happens, then the applicant can submit more information. So maybe beyond that physician certification form, the doctor wants to write a more comprehensive letter about the patient's needs and why the doctor believes the person is nursing facility eligible, or provide some additional medical records from the primary doctor, from specialists, whoever. So additional information can be provided for the medical director to review. And if even after that, the medical director looks at whatever information they have and determines they still believe that individual applicant is nursing facility ineligible, then the person is issued a notice and they have appeal rights. Okay. So and we're not going to get into those appeal rights for purposes of time today. But if the outcome is the assessment says, yes, the person's nursing facility eligible, the doctor's physician certification form says they are, then the independent enrollment broker, Maximus, sends that communication to the applicants based on where they live, appropriate county assistance office. They are then responsible for doing the financial determination. So, and the financial eligibility determination involves looking at documentation, verification of the person's gross income, looking at their resources, and we'll talk a little bit more about how each of those are defined, and they're responsible for doing a 5-year look back period. And the purpose of that 5-year look back period is to see if the person basically gifted away any of their assets over the past 5 years. Because if they have, that has a very strong likelihood of getting in the way of their immediate eligibility. And the point of that really is to try to keep people who in fact have resources and have the ability to pay for their own care for whatever, length of time their money might last, and keep individuals from basically gifting their money away, giving their money to their adult children or grandchildren or whoever it might be, in order to then look like they have no money, when in fact, last year they, gifted $50,000 away. So that's the point of the 5-year look back period. Okay, next slide. Okay, so the current income limit for nursing facility eligible in a nursing home or to get the services in the community for 2021 is gross income of $2,382 a month. In terms of income, the state is only, in this case through the county assistance office, is only counting the applicant's income, even if the applicant is married. So for income purposes, and it's different with resources, but for income purposes, we're just looking at what's the gross income of the person applying. Okay, next slide. Oh, I'm sorry, that's so fancy. I didn't do this part. So, what income is counted? All income. There's really not any income that's excluded. So does the person have Social Security, retirement, or Social Security disability? Do they have pension? Are they getting workers' comp? Do they have money earning interest such that, there's, it's generating income from dividends, et cetera? Are there any kind of alimony or some other kind of support payments? All the income is counted, and it's counted, again, by gross. So, an example would be somebody's only income might be Social Security retirement. And that Social Security retirement is, what they see in their perhaps directly deposited in their checking account, is $1,200 a month. But in fact, that $1,200 is after Social Security might automatically take out their Medicare Part B premium. So we're not counting what gets deposited into that person's checking account. We need to know what is their gross income before any deductions come out. So that's what's counted. It's gross and of the applicant only. What about the resource limit? So if the individual is single, then the resource limit is $8,000. And again, we'll talk a little bit more about, well, then what's a resource? Some exceptions. If there are dependent children in the household with the person under the age of 21, then there's no resource limit. Resources aren't counted if the applicant has dependent children under the age of 21. Now, what about the person's married? If the person's married, it gets definitely more involved, and there are formulas to determine, just exactly how much total resources then can the applicant and their spouse have, and still potentially be eligible for nursing home level of care. Next slide. Something just slipped my. Oh, I know what I wanted to say about that piece about resources. It doesn't matter, at least not Pennsylvania law. It doesn't matter when there are resources and the applicant is married. It doesn't matter whose name the resources are in. So, the couple might each have their own checking account and then perhaps a joint account, or, whatever the dynamics might be. It doesn't matter, whose name is generally, doesn't matter whose name is on the account. It's basically, the marital law that says what's mine is yours and what's yours is mine. So it doesn't, it doesn't change anything if you say, well, yeah, but that's my husband's checking account, or that's my wife's checking account. It's just in his name or just in her name. For purposes of counting resources for this, this program, they're counting whatever is in the spouse's name, even if it's the spouse's name only. Again, this is not exhaustive, but, what counts in terms of resources, cash, money in bank accounts, checking, savings, wherever, somebody's money might be, stocks, bonds, mutual funds, whatever, whatever vehicles somebody might have, perhaps investments in. Vehicles count, but they exclude one. So if you have a vehicle that's your primary vehicle, they're not counting that. Property other than the home the person resides in counts. So in other words, people own other property, they own another home, they have rental properties, whatever it might be that they don't live in, those are counted as resources. The home the person lives in, if in fact they own it, mortgaged or otherwise, does not count in terms of resources. The applicant's money in retirement accounts, minus any early withdrawal penalty. So perhaps somebody's applying and they have money in, an IRA or a 401k, whatever it might be, and based perhaps generally on their age, or perhaps on the fact that maybe they're still working. That's unlikely in this scenario, but based on their age, if they can't tap that retirement account until a certain age, and they're not at that age, the county assistance office is still obligated count what's in there minus the penalty that the person would incur if they took an early withdrawal. So unfortunately, it doesn't just then get to be excluded. And life insurance, a life insurance policy with a cash surrender value counts. So if there's any type of a cash value in a life insurance policy, whatever that cash value is, that will count towards the resource limit. Some examples of things that don't count: an ABLE account, which is a Pennsylvania account that folks can set up when they meet certain criteria and are an individual with a disability. The money in those accounts do not count towards resources. If somebody already has a special needs trust set up in terms of that applicant, that whatever money's in that special needs trust doesn't count. If a person has or perhaps wants to use excess resources to buy a prepaid irrevocable burial trust, then that does not count, because in essence, that money's really gone. You've paid it to whoever, a funeral director, whoever it might be. So that doesn't count. Again, they exclude one motor vehicle. So, no matter what that vehicle might be worth, they don't count that. They do not count the property where you live if you own your own home. If there is income producing or business property that is, basically the person's income, then that's excluded. A life insurance policy that does not have a cash surrender value. So somebody could have a life insurance policy that's worth $100,000, but if it's only payable upon the applicant's death, then it's not a resource to be counted. And they don't count things like personal belongings, household things, jewelry. Any of those things are excluded in determining whether somebody meets the resource limit.
Janice, we have a question in the chat.
Sure.
They are asking,
that even though millions of people came in, that every year millions of people leave the Catholic Church for various reasons.
the question in the chat, Janice, is how does long-term care insurance factor in?
Yeah, that's a great question. I think, I don't think we've ever come up against that scenario. I'm not sure. I don't think it's counted as a resource. It would just be if in fact the person's determined otherwise eligible, then the long-term care insurance would pay first. So Medicaid always pays last. And I think generally long-term care insurances are, complicated, but I guess maybe just to try to make a simple scenario, if I had long-term care insurance that covered, I'll just kind of make up a scenario and a number, and my long-term care insurance covers $3,000 a month of nursing home level of care, in a nursing home. If I am otherwise separate from that long-term care insurance, otherwise income and resource eligible for Medicaid to pay towards my long-term care, then I would get approved. The person's long-term care insurance would be paying first. So again, just making that example up, $3,000 a month, my long-term care insurance is going to pay that towards my nursing home care in a nursing facility. And then Medicaid would pay the rest. I have to say, I've never seen that scenario. And I'm guessing in large part because people probably have either exhausted what coverage they had with their long-term care insurance, or likely people in a position to afford long-term care insurance, especially, they have been paying for it themselves, generally have other, have other assets and perhaps even higher, income high enough that they're already out of the income bracket, they've got higher income than the income eligibility. But it's a great question, but not a scenario I've ever seen.
Good question, Margaret. A couple of other questions regarding income. Does the spouse's IRA count as a resource?
It does not. No, it does not.
Okay, is that good, Beth? And finally, from Jody Cosser, does VA aid and attendance count as a resource?
Oh, that's a good question.
If you want to answer us
Okay.
tomorrow,
Yeah.
or let me
Yes, I can check. Yes, I think it does. I just don't know the nuances of how it does, and how it factors in. But yes,
Okay.
I can.
Jamie, we'll save those questions then in chat, and Janice will get back to us. And finally, the last question that's here is about the 5-year look back. What happens if property or cash was transferred to someone else? That's counted as a resource, is it not, Janice?
Yes, and I think actually we're gonna get to that in upcoming slides.
Okay.
We'll be able to answer that. So again, if the person is single, resource limit is $8,000. That piece is clear and unambiguous. If the person is married, then the spousal impoverishment protections do apply, and the spouse can keep half of the combined verifiable countable resources. And as I said, this is when the scenario gets much more complicated, and depending on in our case, depending on what the resources scenario is, if people come to us for assistance, we almost always then refer them to a private elder law attorney, because we are by and large working with people who are low income, low resources. So, if people come to us with, resources such that, the scenario is then far more complicated than what we deal with, that's when we send them to a private certified elder law attorney, to help them, because that's what those folks do. And that's their expertise, and they can provide, hopefully the best advice about what, somebody may, want or need to do in a scenario like that. Okay, next slide. Okay, so again, that 5-year look back period is primarily done to see if there have been transfers, of assets for less than fair market value. So that could be, a cash resource. That could, of course, also be something like, giving somebody your home, or, adding an adult child or a sibling, whoever it might be, putting them on the deed to your home. They're going to look at, at those kinds of things, but in particular, they're looking at 5 years worth of bank statements. So whatever kinds of, or whatever statements for whatever kinds of investments somebody has. So, if somebody had, whether it's a mutual fund, money in checking, savings, wherever they may have had any type of resources over the past 5 years, they need to provide verification of all of those going back 5 years. In the case of checking savings account, typically the county assistance office is going to ask for every month over the last 24 months. And then those prior 3 years, usually asking at least for 2 bank statements per those prior 3 years, and typically spread out. So, like January and July of those prior 3 years, going back years 3, 4, and 5. Years 1 and 2, the county assistance offices at a minimum will require monthly statements. And then, the county assistance office is going to review those and generally look at, any transaction over $500, that isn't clear and understandable, so, a $500 check that's, written towards, to the landlord or to the mortgage company, that's not likely going to be questionable because it's probably going to be pretty clear from the bank statement that that's, it's a payment on rent, payment towards rent or mortgage or whatever it might be. But otherwise, the county assistance office is going to ask for, an explanation of, there's many cash withdrawals, $600 here, $500 here, and they're going to ask for those to be explained. What was that cash withdrawal for? Or where did that money go? Or checks written to $600 to, to John Smith. They're going to want to know who's John Smith and why did you write him a check for, $1,000? And if John Smith is, the plumber with John Smith Plumbing, then hopefully you've got documentation to show, that was a plumbing issue. That $1,000 was what I paid John Smith, the plumber, as opposed to, John Smith is my brother. Well, you gifted away your money unless there's some other explanation for why, you wrote a check to your brother. So they go through those statements as they're required to do, and then we'll question anything that's potentially, questionable, and people will have a chance, to explain them. Somebody isn't necessarily, just then denied. The county assistance office worker working on that financial eligibility determination should be reaching out to the applicant or, somebody who's applied on the applicant's behalf and say, here's the things we're questioning that we need an explanation on. Okay, next slide. Okay. So, and I think this hopefully gets to the earlier question, what happens if over the past 5-year look back period, the bottom line is, the applicant has transferred assets for less than fair market value. Then the county assistants, that aren't otherwise explained. It comes down to, it was a transfer of assets. And so now the county assistance office is going to look at what was the amount that was transferred, and look at what's the average daily rate of the nursing home care that Medicaid pays, towards nursing home. This is, I think, 2020 average daily rate. I did not find an updated information on 2021. And from that, then determine, okay, well, let's take that average daily rate, divide it into the amount that was transferred, and in this case, it equals, 25 days based on that daily rate. So in that scenario, the person should be still approved for the nursing home level of care, but they're approved with a 25-day penalty period where they're going to be responsible to pay for that nursing home level of care. And, then the question, of course, will be, do they have those resources? Is there a nursing home willing to take them, knowing that they perhaps don't have a way to pay for the first 25 days of care? That's, where you get into a potentially complicated situation. People can request an undue hardship waiver. And there are certainly times we, advise people to do that, just depending on the scenario. What was the money that's unaccounted for, or it's accounted for? It's just, in fact, was, it was a transfer of assets. What's the scenario around how the money got transferred? And, might there be a case where, the person should try to make, a case for themselves where, it was this and this scenario, and ask the county assistance office to, to waive that penalty period. Next slide. Okay. So let's talk a little bit about people whose income, and maybe I don't know, did you want me to pause there? Were there questions related to what I just covered?
Yes, there is a question here concerning from Gloria. Do you ever provide legal assistance to someone who is just over the limit? I assume you mean income, Gloria. Gloria?
Yes, sorry, I was muted.
Okay, and someone who is just $50 to $100 over the annual income guidelines cannot afford to hire a private attorney.
Right. That question's right on the money, excuse my pun. And we're going to get to that in these next slides.
Thanks.
Sure. Are there other questions?
There's one more.
Nothing right now.
Okay, nothing else?
Let's see.
Mary B has a question, Jeannie.
I'm sorry, Jay.
Mary B asks, what about guardians who are making large withdrawals?
I responded to her question
Oh, I'm sorry.
in the chat. I'm sorry. That's right now, that's everything. So.
Okay. So, so Gloria, getting to your question, what about if somebody is over the income limit? Even by, as you said, what could be $50, $30 a month, $8, whatever it might be. Up until I'd say, I don't know, maybe 2 years now or so ago, there wasn't really anything anybody could do unless they can afford to spend down their income. And unfortunately, until recently, you weren't spending down to the income limit. You had to spend all the way down to the waiver income limit. You had to spend all the way down to the SSI benefit limit, which, right now is probably $800 or so, which, most people just weren't in a position to do. But we've been working with Achieva and with the state, with the legal folks, the attorneys at the state level, and have had success in, working out a way that people who are over the income limit, not more than $500 over the income limit, in the case of people who are 65 and older. There's actually, people can actually be more over the limit than $500 if they're under 65. That's actually a very new development. But for people 65 and older, if they are over the income limit by $500 or less, and so again, the income limit for 2021 for long-term care paid for by Medicaid is currently $2,382 a month, remembering that only the applicant's income counts. So if they're within $500, or in this case, monthly income no higher than $2,882 a month, then they can, if they choose, still potentially be eligible for long-term care services paid by Medicaid by depositing the amount that they are over, in this case, the $2,382 limit for 2021, into a pooled income trust. And Achieva is the organization that manages that pooled income trust. And it's, fairly involved in terms of, lots of paperwork and documents that have to be completed. But the good news is people can do this now. We have assisted several people in doing this, and we are still working, with some clients. And so and we'll get into these in a bit more in this next couple slides, but the idea is, the person puts in, so let's say they're over the income limit by $200 a month. That $200 a month goes into the pooled income trust monthly. Every month they're sending, somebody on their behalf or themselves, putting the $200 into the pooled income trust, and then really turning around and using their own money, that $200, to pay towards something, and we'll get into some examples related to their care needs. And then they are, but then they are still waiver eligible. In terms of costs, with the Achieva Family Trust that runs the pooled income trust, it's $100 initially to open that trust with them, and then a $50 annual administration fee. And then the amount, again, that's equal to, the amount that exceeds the waiver limit, the waiver income limit, that goes, into the pooled trust, but then it really comes back out and is spent on some type of care that the person needs. So, and somebody needs to, somebody in this scenario either needs to be able to, understand and sign all the legal documents that are a part of this process, or have a financial power of attorney, or have an actual legal guardian, a court-appointed legal guardian. And as I said, we do work with people and have been successful working with DHS, the Department of Human Services, their legal counsel, and in helping, and with the Achieva Family Trust, helping people, open and then get the services they need, through the pooled income trust. This only applies to people trying to get the home-based services. And that's because if somebody's trying to get Medicaid to pay for nursing level of care in a nursing facility, then they can already spend down and basically they're going to pay, because people are going to pay towards their nursing home level of care anyway, and we're going to get into that. And it's really how our attorneys kept pushing this with the state, saying, you know, you really have an unequal system right now. When somebody's income limit, they still have to be under the resource limit, but somebody's income could be, you know, $3,000 a month, as long as they're clinically eligible for nursing home to be in a nursing facility and they're resource eligible, they can go, and Medicaid will pay for them to be in a nursing facility. That person's just going to pay all of their income minus a $45 special needs allotment, you know, that they get for personal kinds of things. But then on the home and community-based side, if somebody's trying to get the services in the community, the same thing didn't apply. And so, you know, after really, I think, quite a few years of attorneys at the Health Law Project advocating for the state to have, you know, not only a system that's more fair, but a system that also supports what the state says they support, which is helping to keep people in the community when that's, you know, if that's what they want. You know, if people don't want to go into a nursing facility, or they're in a nursing facility and want to come out of a nursing facility and get what supports they need at home, you know, the system was not, you know, it was kind of not, you know, walking their talk by saying, yes, we want people to be living in the community when that's their preference, but making it harder for them to do that. So this is, you know, this has really been a, you know, a good win, we think, you know, for the people who are trying to get services in their homes. But in fact, you know, could be in this case as much as $500 a month over the income limit. And so if, you know, if you have, you know, you or somebody, you know, in this scenario, absolutely send them to us, send them to our helpline. And, you know, we'll take a look at what their situation is and see, you know, if we're able to actually assist them or connect them with another attorney. But people really do need an attorney to do this. So, you know, in the case of somebody interested in setting up the pooled income trust who is age 65 or older, the money they put into the trust monthly, and that amount that they're over the income limit for, must be spent down, you know, on the person's medical or some other type of care expenses in the same month. So, and there's several ways somebody might be able to do that. And again, we help people sort through all this and figure out, you know, what's their particular situation and what might they be able to do so that they can set up the pooled income trust, you know, basically put the money in the trust and then turn around and have that money pay towards, you know, something involving their care on a monthly basis. So for some people, what they are able to do is pay a home health aide, one of the very things they're likely trying to get. You know, they may be trying to get other things too, like home modifications, you know, an accommodation to their bathroom, a ramp to get in and out of their home, many things that the in-home waiver programs pay for. But again, it needs to be something that an expense they're going to have ongoing monthly. So it might be then, you know, they're going to either through an agency or hiring directly, you know, they're $200 over the income limit for the in-home waiver services, then they're going to hire their own aide, and, you know, that aide is going to provide them with, you know, $200 a month worth of care. And that has to be based on, you know, a realistic, you know, hourly rate that's really compensable with what people get paid under the Medicaid waiver. You know, so the person can't say, okay, fine, I'm going to hire my neighbor. I'm going to pay him $200 an hour and provide me 1 hour a month of care. That's not going to fly with legal counsel at the Department of Human Services. You know, it has to be, you know, basically close to that hourly rate that, you know, typical average somebody gets paid under the Medicaid waiver. You know, maybe somebody has an outstanding medical bill, you know, and a big enough bill. We're not talking about a $300 bill. We're talking, you know, thousands usually dollars of a bill, and they are working on paying that off, and they're making a monthly payment to the hospital or whoever it might be. That could be one way that they spend down that income. So, you know, it's a bit of a convoluted setup in that, okay, I have to give that money to the pooled income trust, and then the trust is going to write a check, you know, to, you know, ABC Hospital that I owe $10,000 to. But it works. It's, you know, it's not without its gyrations here, but it works, and it can be a huge benefit to people who are, you know, within $500 of the waiver income limit. And as I said, this is just applies to people trying to get the home and community-based care paid for by Medicaid. And there are rules about what could, you know, what the person can be spending down monthly through the pooled income trust. Things like, well, Medicare prescription drug costs can't be used, but they shouldn't even have any once they're on the waiver. People who have Medicare and getting the home and community-based Medicaid waiver, their prescription drug costs are zero. But they also can't use things like their Medicare Part B monthly premium. So there are, you know, there are things people can spend that down on monthly, other things that won't be approved by the Department of Human Services legal. Okay, next slide. So people who are over the $500 income limit and are under 65, there's more flexibility there with how they can use the money if they're going to, you know, set up in a pooled income trust. And it doesn't have to be, you know, spent, you know, it doesn't have to be the monthly spend down like, you know, on medical care or some type of care to keep them at home, the way it does for people who are 65 and older. But as I said, there's also just a, you know, very new to us, that in fact, people under 65 can have an income limit even higher than beyond the $500 over the waiver income limit, in order to get, you know, and still get approved to be in the pooled income trust and be eligible for the home and community-based waivers. But there is a difference, actually a significant difference in terms of if I'm under 65 and but my income's over, you know, how I have to spend that money that I'm going to be putting into the pooled trust versus I'm 65 and older, then we're back to that prior slide about it has to be spent monthly. And you have to show up front, you know, as part of this whole process and to get the approval from legal counsel at the Department of Human Services. And right now, that's where all of this is still managed. I don't know whether that will change over time, but these are all now happening. Situations where people have been able to do this or are working towards doing this are all happening right now, you know, on a case-by-case basis, you know, with either attorney from, you know, the Health Law Project or some other attorney, the Achieve a Family Trust, and legal counsel with the Department of Human Services. They are approving, in the cases where they're approving these scenarios, they're approving them case by case. Next slide. Okay. Before we get to this piece, did we have questions just about those last few slides and the pooled income trust?
A question from Chris. Already Medicaid qualified, after the state takes the full value of the house based upon the house value as appraised when entering the nursing home, can the house then be sold to a family member at that appraised value without jeopardizing Medicaid? Can we use you for legal questions, or do we need to hire an attorney?
Okay.
Two questions there.
Okay, yes, so the answer to the first question is no. Once you're approved for Medicaid to pay for long-term care in a nursing home or in the community, and the person approved is age 55 or older, then they are subject to a state recovery by the state Medicaid office. So no, somebody who owns their home otherwise is, and they can own their home, then approved to go into, in a nursing home. In the case of home and community based, often that person is staying right in that home they own. But if they're then going into a nursing home, then, and that house is going to be sold, then depending on, what they, if there are proceeds from the sale of that house, then that's going to go, that's going to pay for their nursing home care. They can't then sell that house and gift it away, or, go into the nursing home and then have the deed changed on the house. And now that house belongs to somebody else. No, the individual
Okay,
can't.
but they're asking, can it be an outright sale to a family member, or does the state actually have the first crack at it?
Oh, okay.
That it can't be sold.
Yeah. Yes. I don't think there's anything prohibiting that the sale, to a family member or anybody else. It just, it goes back to the fair market value issue. So, you're not
Okay.
going to.
And as long as it's sold for the appraised value, then it's a legal
Yes.
sale and it doesn't jeopardize their Medicaid.
Well,
And then the second,
right. I'm sorry. I mean, it could potentially jeopardize their Medicaid, because if the sale of the house results in, let's say it's a house that's paid for, and after costs involved in selling a house, the person has $100,000 now. Yes, that will certainly impact their Medicaid eligibility, because now they're
Okay,
going to
because
be
it's a
expected to, right, then now they've got more than $8,000 in resources. So generally, yes, again, that would be in the case of a person who's single. If the person is married in a nursing home and has a spouse still in the community, then it gets more complicated. And it's definitely not cut and dry, as I just said.
okay. So Janice, the answer to the question is using you for legal questions or hiring an attorney is to hire an attorney?
Probably, but again, I think I do think it can depend on the scenario. Again, I think kind of keeping in mind that, as a nonprofit, our work focuses on people who are, low income, low resource. But, somebody could have a, $150,000 home and have a mortgage on it that's $120,000. So in, in that case, we may be able to be, helpful and just even kind of, walking them through the scenario, trying to answer all their, answering all their questions without taking, what very little money they or their family members going to have left after the sale of the house, to pay an attorney. Versus somebody who's got a $200,000 house they own outright, and they're going to net close to $200,000 from the sale of their house. We're going to refer that person to a private attorney they would have to pay.
So they could email you then at jmeinert@phlp.org.
Yes. Yep.
Without
Or
question.
call our helpline.
Already, or call the helpline.
Yes. Yes. Just because we have an intake system, and we try our best to keep everything flowing through that single place. But yeah, but don't hesitate to email me. I can answer questions, or I can say, yes, this looks like something we can help with, and I'm going to forward your email, onto our intake paralegal.
Okay, and I'm typing that into the chat right now. The number.
Okay. Yes, and it's on the slides.
Okay.
It's yep.
Which you're going to provide.
Right. Okay.
That's the last.
Okay. So what about payment towards the cost of nursing facility care? And I kind of just alluded to this a few minutes ago. If the individual is single, they're approved, they're clinically eligible, they're financially, income and resource eligible, and they're approved, to go into a nursing facility that Medicaid, is going to pay for. The person is also paying towards that, that care. So, and generally it is the person's gross monthly income minus a personal needs allowance of $45 a month. That's a flat set rate determined by the state. It doesn't vary and certainly should not vary from one nursing facility to the next. And then there's a few other things that can be allowed for that person's income to pay towards. So one easy, I think, example is if that person who's now in or going into the nursing home is on Medicare and they are paying their Medicare Part B premium. Sometimes people's income is low enough that the state is paying that Medicare Part B premium. But if otherwise they're paying that Medicare Part B premium, then the state that is going to allow them, to keep paying that. And often the case is that comes directly out of somebody's Social Security check when they're receiving Social Security disability or Social Security retirement. So, they'll, the state will allow that to continue. That person can keep paying their Medicare Part B premium. They don't want people to lose that health insurance, especially when that health insurance is their primary insurance. It pays before Medicaid does for any care outside of the nursing facility. And if somebody's enrolled in some type of supplement to their Medicare, a Medicare Advantage plan or a Medigap policy, if in fact that person feels they want and need to keep that policy, often they don't need it now because they're going to have Medicare, and by virtue of being approved for Medicaid to pay for their nursing home, they're also getting Medicaid insurance. So they will have Medicare primary, they'll have Medicaid secondary. So often don't need to keep their Medicare Advantage plan or their Medigap policy. But if the person wants to do that, and there could be, various reasons why they really want to keep paying for that, then they'll be allowed to do that. they can keep paying for that Medicare supplement out of their gross monthly income. And then if the applicant is married, that's going into the nursing facility, then their spouse, what the system refers to as the quote unquote community spouse, their financial needs, where they're living, what it's costing them, not factoring in everything that it's costing them, but certainly factoring things like rent or mortgage or property taxes. Then they'll look at, the applicant's spouse, they'll look at the community spouse's income, the applicant's income, and then look at what are those expenses that the community spouse may have so that they can keep living, so that spouse can keep living in the community. So, the system tries not to impoverish the spouse of the person going into the nursing facility by taking, both the income of the applicant, and perhaps some of the income of the spouse. And there again are, there are formulas for figuring out, who in this married scenario, who has what income and what are the expenses, the living expenses for that person, that spouse who's still going to be in the community. And that then the county assistance office, lands on a figure that says, okay, here's what your cost is going to be towards nursing home care. And people can appeal that if the bottom line, literally the dollar bottom line is one that, the couple thinks, well, there's no way I'm not going to be able to, I as the community spouse to be able to, stay in my home, if I have to also, if my spouse also then has to pay so much towards the nursing home. So they do have a right to appeal that and take that in front of an administrative law judge. Okay, so once somebody is approved for long-term care, and this is the scenario whether it's somebody approved now for long-term care paid for by Medicaid in a nursing facility or at home, getting the home and community-based services, their Medicaid is going to be in a Medicaid managed care plan. That's how the state has structured this. There are 3 Medicaid managed care plans across the state, doesn't matter where in the state that person lives, that the applicant has to choose from. AmeriHealth Caritas, and it says /Keystone First because it's the same company, same parent company, but in different parts of the state, they call themselves one or the other. In the Southeast, they're Keystone First. Everywhere else in the state, they are known as AmeriHealth Caritas. Pennsylvania Health and Wellness, and UPMC Community Health Choices. Those are the 3 Medicaid managed care plans. People have to choose, and if they don't choose, they'll be automatically enrolled in one of them when they're determined eligible for Medicaid to pay for long-term care in a nursing facility or to pay for it at home. The Maximus, the independent enrollment broker that we talked about much earlier on, part of their job in shepherding people through the application process is to explain about the managed care system, about the 3 plans, about their choice of plan, and let people know, they want to decide which plan so that when, if and when that person's determined eligible for Medicaid to pay for their long-term care, and the county assistance office says, okay, you're eligible. We've got you, effective, today's date in the system. They automatically enroll the individual without any wait time into one of those 3 plans. And so that piece should happen for folks by way of the independent enrollment broker, by way of Maximus. Once people choose a plan, they're not locked into that plan. People can change their plan at any point during the year. The change doesn't happen, immediately, depending on when in the month they ask to change their plan. It could be then the next month or perhaps the month after at the very latest, but people can change their plan. All the plans have to cover the exact same services. So whether we're talking about the long-term care services in the nursing home or in the community, they all have to cover the exact same range of services. But they can also provide, and offer additional benefits. And sometimes the plans do that as an incentive to get somebody to pick their plan over the other 2. For example, and I think this is still the case with one of the plans, that they offer extra dental benefits in addition to what they're already obligated to pay for somebody, on Medicaid in a community health choices plan. And then the CHC plans also pay for people in a nursing facility, actually people in the community as well, pay for non-emergency medical transportation for nursing facility residents. Generally, the nursing facility is arranging and coordinating that transportation, but in terms of who's obligated to be paying for it, it's the community health choices plans. Okay, and then for people who are in a nursing facility, what happens then? Like what services and supports are they entitled to and are to be getting that Medicaid is paying for? And in this case now, Medicaid through one of those 3 community health choices plans. The state's paying the plans are then paying the nursing facilities. So every resident is required to have what's usually just referred to as a care plan, who is, in a nursing facility. The community health choices plan is also required to provide each nursing facility participant with a service coordinator. So, people who are in a nursing home right now or have family members or loved ones in a nursing home, if you're not clear who their service coordinator is with the community health choices plan, it's probably worth finding that out. And maybe right now on a day-by-day or typical basis, you don't need to contact them, but it would be good to know who that person is and perhaps even make contact with them, because at some point you may need them to assist with whatever perhaps services or problems even that are coming up in the nursing home. And that service coordinator should be involved in developing that care plan. And again, when people have loved ones in a nursing home, when they want to be and their family member wants them to be, really should be a part of developing their care plan. And an involved family member, again, with the participant wanting the family member to be involved, they should be, you should be a part of developing the care plan and know what the care plan is and have a copy even of the care plan. The service coordinator should be from the community health choices plan, should be working with the nursing facility staff, and helping determine, the participant, the person now in that nursing facility, what their needs are, and who's to be providing what services in terms of that care planning process. If that individual has Medicare, as people often do, or veterans benefits, are in need of behavioral health services, that service coordinator employed by the person's managed care plan, their community health choices managed care plan, is responsible for helping coordinate those kinds of things. And again, another reason why it's it's helpful to know who is the service coordinator for that that individual that's currently in a nursing facility being paid for by Medicaid. Next slide. Access to behavioral health services for nursing facility residents. I just wanted to highlight this piece because since the implementation of community health choices, and depending on where people live in the state, that implementation occurred in phases. So in the southwest part of the state, there were 14 counties part of implementation of in January of 2018. In 5 southeast counties, that implementation happened in January of 2019. For every other county in the state, that implementation occurred in January of 2020. So statewide now, everybody's in this, who's in a nursing facility being paid for by Medicaid is in a community health choices plan. And everybody on Medicaid in a nursing facility has 2 behavioral health, two managed care plans. They have a community health choices managed care plan. That's their physical health plan, responsible for paying for their nursing facility care and services, and paying for their healthcare services, secondary in the case of people with Medicare. But if I'm in a nursing facility and then I need to go to the hospital or the emergency room, or I need to have surgery, or I need to see a specialist that's not available, to see me in the nursing facility, then I'm going outside of the facility, and, my insurances are then responsible for paying for that. Not, the nursing home isn't the, it goes back to, well, what insurance do I have? Is my Medicaid community health choices plan my only insurance, or do I have Medicare or other, do I have insurance related to a, spouse's employment, whatever else it might be. But the community health choices plan is not responsible for paying for behavioral health services, because people have the physical health, their community health choices plan, one of those 3 that we talked about on the earlier slide. And they have a behavioral health managed care plan. Individuals don't have a choice in the Medicaid system of who their behavioral health managed care plan is, the way there is a choice on the physical health side. Their behavioral health managed care plan is determined by the county they live in, or in the case of a nursing home resident, generally it's, the county where the nursing facility resides. And so if somebody in, a nursing facility is, in need of behavioral health services, again, depending on what other insurance they may have, then, it's to a large extent, the responsibility of, it's the insurances they're going to pay for the care. So, just because somebody's in a nursing facility doesn't mean that, just like they might have to go out in the community to see a specialist, they also may be able to go out into the community to see a therapist or a psychiatrist, or both of those. Perhaps the nursing facilities providing some of those services. Those are really important questions for the nursing facilities. At the very least, people are entitled to assessments. So if somebody in a nursing facility being paid for by Medicaid, they or a loved one thinks, perhaps they went in there being treated for a mental health condition. Then, what's happening once they're in there? If they've been dealing with perhaps depression or anxiety or, any number of mental health conditions, are they still being addressed while they're in the nursing facility? Are those conditions the same, better, worse? Are they on medications? Do the medications appear to be, helpful, working? Maybe they were, maybe now they're not. People are entitled to have assessments about those things. And I say this because a friend told me this just anecdotal story regarding, somebody in a hospital. It was actually somebody in the next bed when her mother was in the hospital, where the hospital resident said to the doctor, "I'm depressed." And the doctor's response was, "Well, of course you're depressed. You're 80 years old." I think that's a horrible response. Horrible. There is nothing, by virtue of any given age, 80 or otherwise, that determines, well, yeah, of course I'm depressed. I'm old. No, that shouldn't be acceptable for any of us or for any of our family members. And again, I highlight this in particular because we've been working with the state, asking for information about, what kinds, what's happening for folks, in particular in nursing facilities. Are they getting behavioral health assessments? Or what are those behavioral health assessments determining? Are they in fact in need of services? What services? What are they getting those services? And so far, the answers have not been very encouraging from our standpoint as advocates. And so I wanted to, just make a point to, recognize that for folks. And if there are issues, people, can and are entitled to be, speaking up about them. And then I see we're already after 6 o'clock. And what about, as I mentioned earlier, and separate from, any behavioral health needs, what about doctors or other kinds of specialists or tests or blood work or x-ray, whatever I may need medically that is happening, that needs to occur outside of the nursing facility, because they're nursing facilities, they're not hospitals. They're not, necessarily equipped to, and expected to be able to provide every medical need somebody has. How are those services paid for? Again, it goes back to what's the person's insurance is, because again, oftentimes people have, in these situations, they have Medicare. We know they've got Medicaid if they've been approved for Medicaid to pay for the nursing facility. And then how they access care is going to be tied to, what insurances do they have? And that's true on the behavioral health side as well. So that's a really important piece to know and to be factoring in. Okay, I might be concerned about whatever, seems like, this sore or whatever it might be. Something doesn't seem right here with, my dad. I feel like he needs to be checked out. Well, where does he go? Well, where he goes to get seen is going to depend on what his insurances are. So those are, important to know. Otherwise, people end up with unexpected bills. And that shouldn't happen. Next slide, I hope. Oh, and then I think this is it. In terms of things like physical, occupational, and speech therapy, those are services provided by the nursing facility staff. That's part of what the nursing facility is getting paid for. Again, based on, an assessment and what somebody's needs are. Do they need one or more or any of these services? And again, that should be a part of the person's care plan. that the nursing facility is required to develop with that person and anybody else that might be, appropriate part of their team. And I think the next, okay, transportation. I'm going to leave this for folks. It's self-explanatory. And then nursing, well, you guys tell me, do we need to, I knew this would be really tough to do in an hour and a half.
Yeah, we're pretty much out of time because our closed captioner has to leave. But
Okay,
is it
okay.
okay if we share your slides and everyone can review that and then maybe give you a
Oh,
call?
Absolutely. Absolutely.
right,
Yes,
awesome.
absolutely. Yes.
So
yes.
much
And-
good
and if-
information.
and it's, I know it's a lot. It's a lot. And if I can just put a plug in for the survey, I think folks are going to be emailed a survey, perhaps not until tomorrow. We were able to provide this particular training this evening, thanks to the Pennsylvania Developmental Disabilities Council, who funds a portion of our work around community health choices and Medicaid, long-term care services. So if folks are able and please, I think there are 5 quick questions, but that funding trickles down from the feds. And so from the feds to the states to us, they do want some accountability, understandably, for their money. So if folks get that and can complete that, I really appreciate it. Otherwise, thank you so much. I appreciate being asked. I hope this was helpful. I know it's a lot of information. Please don't hesitate to reach out to me directly or to call our helpline.
Absolutely fantastic information. Thank you for sharing with us. We definitely appreciate it.
Good.
And we will get this PowerPoint out to everyone so you can take a gander at some of the things we just had to, skirt over at the end there, but the slides are fantastic and really explain the process. So thank you so much, Janis.
Sure. Thank you. Enjoy the rest of your evening, folks.
All right. I took a poll in the chat area and most folks want to save the guidance for our next meeting. I think everybody got an information overload. I will still include these in the slides. So if you want to review them at your leisure, you can do that. And then we'll have questions for the next meeting. Just to recap, our next topic on April 20th, we're going to have our volunteer ombudsman are going to come on. We have a volunteer panel of a couple of our task force members are going to jump on there and just share some information about becoming a volunteer ombudsman and see if anyone would like to join our crew here. And then can you believe it? May 4th is going to be our 1-year anniversary for the Virtual Family Council. We're going to have the state ombudsman, Margaret Barajas, and some special additional guests are going to be joining us. And then on May 18th, we're going to have the peers back to offer their peer perspective. So thank you so much, everyone. Have a fantastic evening. And as always, contact the State Ombudsman Office, 717-783-8975, or shoot us an email, ltc-ombudsman@pa.gov, and Mr. J. Rotz will take care of you from there. Have a great evening, everyone. Thanks for joining us.